All right, this is week 7 of our onboarding classes, and we are going to go ahead and get on with it. We admit a few more people. All right. Okay, so this is week 7. And this week, what we are going to be going over is we're actually going to be doing a filler recap. Remember that you can do your second filler training as soon as you hit your 8 patients. As soon as you hit your 8 patients, please go ahead and reach out to me so I can get your second filler training done. I know several of you have already done that and already done your second filler training. So please, as soon as you hit your 8, reach out to me. We want to make sure that we get that done as quickly as possible. And then we're also going to be going over some just general MFL questions and AR questions, and then we have our marketing homework. All right, so let's go ahead and let's jump back into our filler. So if you remember, this is our presentation from training. But we're going to go through this rather quickly. We're obviously going to be skipping the ultrasound section. So just to remember the facial anatomy, whenever you're working with filler, you always want to be aware of what's going on underneath the skin, but you specifically want to be aware of what is going on with the vascular under the skin. So everyone remember that you have your external carotid and it kind of goes up and then it branches up into the facial artery. It's actually in front of your masseter. So if you bite down and right in front of your masseter, you can feel a little foramen, which means hole. And that's where your facial artery comes out. Your facial artery tracks up, and this turns into your angular artery, and then it continues on up into your supratrochlear artery, which is right up here. You obviously have your superior and your inferior labial arteries, those that feed from your facial artery and they feed your lips. Your mental artery is going to be in your chin, and then you also have the transverse facial artery. How your transverse goes, your external carotid continues on up and then it cuts across your face, and this is the transverse facial, and then you have your nasal. This is a side view of kind of the major blood vessels that we need to be aware of. And then you also need to remember that we have different layers of the face, and you need to be cognizant of which layer you are in. This is really important whenever you are selecting a product and you're looking at the G prime of a product. If you have a really, really high G prime product, you do not want to lay it into layer 1 or 2 because it's going to look like cement. A really high G prime product has to be laid deeper, meaning between layer 4 and 3. If you want to use a really soft or light G prime product, those types of products can be laid in layer 1 and 2. A medium G prime would be layer 2 and 3. These are the primary fat pads of the face. Once you hit the age of about 35, you stop producing your own natural collagen. And what will happen is that your fat pads will slowly start to separate and disintegrate as we start to age. So the purpose of filler is to add volume back where volume has been lost. So if someone's complaining of that their tear troughs are starting to look hollow, the very first thing that you want to look at is you want to look at their midface and add volume back to their midface before you tackle the tear troughs. This is that kind of age progression of the fat pads. We stopped here. We mapped it out during training, but obviously we're not going to do that. But these are the big arteries that you kind of need to be aware of. Also with the infraorbital artery, this is traditionally directly below the pupil. So when we start mapping out for cheeks, that's why it's so crucial to do that 1 centimeter lateral of that pupil line. That way it helps buy you a little bit of safety whenever you're doing mid-face needle to bone filler. So what are dermal fillers? Basically, they are all some type of gel-like substance that are injected underneath the skin, and it helps restore volume, smooth lines, and soften creases. They typically come anywhere between a 1 ml and a 1.2 ml syringe, and it comes with 2 native needles. One syringe of filler is about the size of a blueberry, and 10 syringes about the size of a ketchup packet. So when someone thinks about how much filler you're putting into somebody's face, you obviously don't want to blow, 2, 3, 4 syringes in someone's lips by any stretch of the imagination at one time. It is really not that much product. These are all the different things that dermal fillers can do. So you can do tear troughs, you can do hand, you can do nasolabial folds, you can get rid of little scars, you can redefine someone's jaw, you can do their chin. Obviously, you can do their lips, all sorts of kind of crazy things with filler. Again, the goal is to provide volume where volume has been lost. These are the different types of fillers out on the market. At MFL, we only carry the hyaluronic acid fillers and Sculptra, which is the polyalactic. So the hyaluronic acid fillers is the only filler that can be dissolved with hyaluronidase or Hylenex. What is G prime? The basic core of G prime is essentially the thickness or the stiffness and the viscosity of the filler. The higher the G prime, the stiffer the product. So when you look at this chart, this is the G prime chart, and it has all of the USA approved fillers on the US market. You have Restylane Lift, which is going to be right at the very, very peak. And at the very other end of the spectrum, you're going to have Restylane Refine. It has the lowest G prime, but also has the most stretch. So you can see where these different products fall on the G prime chart. When you first start doing filler, my recommendation is to find one brand and stick to it. And stick there for a good, 6 months to a year. Get really comfortable with that before you start trying to use different products. The reason we say that is because you don't want to try Restylane Lift one time and then do RHA4 and then do Voluma and just kind of bounce around to all these different types of fillers. Get comfortable with one, and then after a while, you can slowly start to add different products. All right, let's talk about kind of what some of the different products are with the G prime. So low G prime are going to be Refine, Redensity, Juvederm Ultra. Medium G prime, Define, Contour, RHA3, Juvederm Ultra Plus, Versa, and Kiss. High G prime is going to be Lift, Voluma, Restylane L, Volux, Silk, and RHA4. Now with Restylane Silk, while it is a super high G prime product, the molecules are tiny, and so it cannot be laid in layer 3 or 4. It actually has to be laid pretty superficially. It's really good for the perioral lines or the lips. However, it's very, very hydrophilic, so it loves water and it has profound swelling. We actually don't carry it anymore within MFL because of all the swelling that it causes, but if you work somewhere else and they want to use Restylane Silk, just know that that's an option, considered a high G prime product, but people will put it in lips or perioral. Okay, going over the physical exam, you want to make sure that they don't have any type of allergies, specifically lidocaine, because all of the fillers have lidocaine impregnated in them. You can request some fillers that are lidocaine free, but not all of them come that way. So you just need to ask Stephanie. If you do have a patient who is allergic to lidocaine, reach out to Stephanie and she can give you a list of the ones that are lidocaine free. You also want to ask if they've had any type of cosmetic or any surgeries, facial surgeries. If they have a chin implant, if they have previous filler, if they were in a crazy car accident and they have a plate in their face, you need to know those kind of things because the filler might react a little bit different if you're going to lay it very deep to the bone. You want to know if they're taking any type of medications, if they have a history of cold sores, if they're pregnant or breastfeeding, and any autoimmune disorders. You want to make sure you do a good physical exam, take lots of pictures. You do want to try to feel for the pulses, especially in the lips, just so you have an idea of where they're at. You can feel for the facial artery. You can even feel for your infraorbital artery. You just kind of put your finger on it and you can feel where it's kind of pulsating. Also, whenever you're doing your assessment, you need to note in your chart what side of the face that the patient either might sleep on or might have a little less volume. That's important because if you're going to be doing someone's mid-face and they say, oh, my face is a little lopsided, and then they come back to you, 2, 3, 4 weeks later, and they say my face is still lopsided. Well, you're sleeping on that side of your face. You're always going to be a little bit more have less volume on that side because you're continuing to sleep on that face. So just pointing that stuff out before you inject any filler will really kind of save you some headaches going forward. This is going to be your pre-treatment checklist. You want to make sure that they stop all NSAIDs a couple of days before. If they do take ibuprofen for pain or they do take some aspirin, they just need to know that they're probably going to bruise. It's not a contraindication. They're just going to bruise. No alcohol for 24 hours before. Again, just let them know they're probably going to bruise if they do drink. Same thing with green tea and coffee. No vaccines 6 weeks before or after. That's a pretty standard and hard, fast rule. If someone is going to get the pneumonia vaccine, it's because they want to get all the benefits of the pneumonia vaccine. So you don't want to stress the body out and have any type of other inflammation or inflammatory response going on from injections. So wait at least 6 weeks before or after for vaccines. The biggest kind of contraindication, though, is going to be if they are on any type of blood thinning medications, and that's on the next slide. If they do have a history of cold sores, you're going to be calling in, or your provider will be calling in Valtrex 2 grams PO BID times 1 day. So these are the hard, fast contraindications. Blood thinning medications like warfarin, Lovenox, Xarelto, and Eliquis. Plavix is fine. That's not that big of a deal. I've kind of talked to some of the different reps, and they're like, Plavix isn't that big of a deal. If they can stop it, that's great. But you might have to get some approval with Plavix. But these other ones, no one in their right mind would ever approve it. Any type of active infection, meaning if they have a giant herpetic outbreak or a giant pimple in the midface, you would not want to stick a needle through a pimple, or any type of cellulite or anything, or cellulitis or anything on their face. If they're pregnant or breastfeeding, or if they're allergic to lidocaine. All right, let's talk about the common side effects. Common side effects are going to be bleeding and bruising. Swelling is going to happen. Lumps and bumps are normal and expected up to 2 weeks. Tenderness and obviously a herpetic outbreak if they have a history of it, but we're going to be calling in that Valtrex for them. For the lumps and bumps, always just tell your patients, especially if you're going to be doing their lips, don't love or hate them for 2 weeks. You're going to feel some lumpy and bumpiness that is normal and expected because they're going to be having inflammation. They're going to feel the filler. It takes time for that tissue to become integrated with that filler. If after 2 weeks they still feel a little bump, you can always just start having them massage twice a day whenever they brush their teeth. Have them do that for 2 weeks. If it's still there after that, then you can go in some dedicated Hylenex and dissolve the little bump. Herpetic outbreak, 2 grams PO BID times 1 day. Bruising and bleeding is very common and should be expected. So if a patient says, oh, am I going to bruise? Yes, I'm putting a needle in your face. If I don't bruise you, excellent. But especially when you're doing someone's lips, it's very, very common. It's very uncommon to not have any type of bruising at all. So this is kind of the lip filler journey, day 1 all the way through kind of 2 weeks. And so just really watch your patients. Sometimes you do kind of have to give them a lot more education and kind of hold their hand a little bit through that 2-week process. But the more education that you can give them up front, it will save you a lot of headaches in the future. These are the major complications that we went over in training. Infection is going to be like cellulitis. Obviously, the 2 types of VOs, a hypersensitivity or allergic reaction, and the delayed onset granulomas. These are the stages of a VO. You have stage 1, which is going to be blanching. You have stage 2, which is going to be that reticular kind of lacy looking pattern. Stage 3 is going to be when you start getting those blisters. A lot of times people will think it's just a herpetic outbreak. Stage 4, you're going to start getting skin necrosis, and stage 5 is full thickness necrosis. Stage 6 is where the VO has to heal by secondary intention and can take up to a year. There are 2 types of VOs. You have an interarterial occlusion where the filler was accidentally injected into the vessel. And then you can have a compression one where you accidentally laid the filler too close to the vessel and it's compressing it, or inflammation is causing compression as well. Regardless, the stages are the exact same. The only difference is with a compression one, it might take a few hours for that to kind of show itself, especially around 12 to 24 hours. So Hylenex or hyaluronidase is the name of the enzyme used to dissolve all HA fillers. So this is what we use. It looks just like this. It's 150 units per ml. Do not dilute it if you have a true VO. Even for if I'm dissolving someone's lips or if I'm dissolving someone filler, I don't dissolve. I don't dilute it at all. I use hyper concentrated because the goal of it is to try to get rid of the filler. And if you dilute it, it's going to take longer and you're going to have to use more of it. So I really just use one or 2 vials. If I'm doing someone's cheeks, I might have to do 1 vial per side, but it does burn. So just tell the patient it burns. All right, so this is our vascular occlusion protocol. Again, having a vascular occlusion for an injector is really like getting struck by lightning. So it is, if as long as you are doing everything appropriately and you are aspirating and you're not becoming cavalier or you're not doing something that is considered a really high risk area, it is essentially like getting struck by lightning. Stop injecting, you're going to immediately start massaging that area, and you are going to immediately kind of flood that area with 1 vial of undiluted Hylenex. Now, if you start massaging that area and blood flow comes back and color comes back immediately, then you're done. You don't have to dissolve. Sometimes it can just get too close and you can move the product away. But if you accidentally got it into the vessel while you were injecting, that's when you're going to have to try to flood the area, and then you're going to have to cannulate it after that. Warm compresses, and then 325 milligrams of aspirin. We will then call in antibiotics. Typically, it's going to be augmentin, the 875 for 10 days, or any type of other appropriate kind of staph antibiotic is what we're using. And then we also call in hyperbaric therapy for at least 4 treatments. Okay, so for treating any type of infection or hypersensitivity reactions, we're going to be doing prednisone and antibiotics. And these are kind of the list of antibiotics that we choose from. So a vascular occlusion can look pretty gnarly, but bruises can look really gnarly as well. So you really want to make sure you're paying attention to the phases and ask yourself, okay, is this any of those phases? So the very first picture that went to the very far left, she has some blanching. So that's going to be stage 1. If you're going up on top, you don't see any blanching, you don't see reticular, you don't see blisters, you don't see necrosis, you don't see full thickness necrosis. This is just a bruise. Same thing with this one. You don't see any of those symptoms. That's just going to be a bruise. You look at this one, it's looking like a kind of red lacy pattern kind of going up and following the vessel. This is going to be stage 2. Down here, none of those stages are presenting itself. And then you look down here and you can see that blisters are starting to form. So this is going to be stage 3. Retinal occlusion protocol. Immediately hold pressure and take the patient to the nearest large medical facility downtown in any major city. The chances of actually reversing this is pretty slim. But again, do not inject noses and do not inject glabellas. Hypersensitivity, if this does occur to the patient, we just call in prednisone, 60 milligrams, Q day times 3 days. We talked about biofilm and how to avoid it in class. The biggest thing is going to be hand hygiene, patient selection, product selection. Non-inflammatory nodules. These typically occur if product is placed too superficially. So just make sure that you're in the right kind of layer of the skin for the appropriate G' product that you are having. If you don't massage that area enough, or if the patient goes and she's like massaging it and pushing it into a little ball, you don't want that either. This is what filler migration looks like. You can see that this injector accidentally, I'm assuming accidentally, injected this patient well above that vermilion border, and she probably has 1 syringe of filler sitting on the top part of her lip. So at this point, you just need to dissolve and start over. Okay, for safety, you want to make sure that you aspirate for at least 6 seconds. Make sure you know the anatomy of what's going on. Watch for color change as you are injecting, and slow, steady pressure. This is the pre-procedure checklist. You want to do your patient assessment. You want to make sure that you get your consents set up for your procedure, and then make sure you prep your patient as far as mapping out, cleaning the patient, putting all of your injection points, doing your topical lidocaine and all those things. Post-op treatment, you want to avoid strenuous activity for at least 24 hours. You can do cool compresses, no ice, no makeup for 24 hours, no facials for 2 weeks. And they can do arnica, either the sublingual tabs or the gel. And it really does help cut bruising time, essentially in half. All right, let's go over some of these areas of how you inject. The first one is going to be cheeks. You're going to draw a line from pupil straight down, a lateral canthus straight down, and tip of the ear to the tip of the nose, and all the way across. And then where that first line crosses, you're going to go 1 centimeter over, because you want to avoid that infraorbital artery. And you're going to go 90 degrees down, and you're going to lay 0.2 at the bone. Make sure you aspirate. Then you're going to go where that line crosses directly onto the cross. You're going to lay 0.1, and then you're going to go 1 centimeter up that line and lay another 0.1. If you do this on either side, you're going to have 0.2 left, because 0.4 on one side and 0.4 on the other side. If you're just doing one syringe, you would still have 0.2 in that syringe. If you do want to do one syringe on this side and one syringe on this side, you would then go back and you would do 0.2, 0.1, 0.1 again on those lines, but just 1 centimeter up. So you're essentially go in between your dots. So 0.2, 0.1, 0.1. And that would be getting you the one syringe on each side. For the nasolabial fold, if you're going to do cannula, you're going to make your pilot hole way down here and tunnel your catheter all the way up. And you're going to lay a 0.41 long kind of linear thread along that border. You also can do a piriform injection. Piriform injection is 90 degrees in all the way down to the bone. Make sure you aspirate. You're very close to where that angular artery is kind of going up. And you can lay 0.1 right at the bone, and that will help kind of pop that nasolabial fold out. If you want to do the cross hatching, you can do 0.1 into each of the little threads. This is the line and fill method that we taught you in training. You want to make sure that you do your dots. So you can also do an additional dot right at the trough of that Cupid's bow. Each line is going to be 0.05. Several of the groups, we had you backfill a needle or an insulin needle. That way it makes it a little bit easier so you can see how much you're putting in. You can totally do that. You just need to make sure that you use a product that can be pushed through a 31 gauge needle. So something like Refine. KISS is pretty hard to push through. RHA2 and RHA3 flow through it beautifully. KISS, you can totally do it, but your hand is going to shake a little bit more just because it's a little bit of a higher G prime product. For a chin, for a male, you want to make sure you're paying attention to the male anatomy versus the female anatomy. Male anatomy, they like their face a little bit more wider. So you can see the injection points are going to be kind of scattered across the entire chin, and do 0.2 in each injection point, 90 degrees down all the way to the bone. Again, make sure you're aspirating. For the female anatomy, you're going to just do 0.1 into each injection point. After you've done that, you can always go back and repeat it, but you never want to do more than kind of 0.2 into each injection. All right. So that was our filler training in 23 minutes, very fast. Okay, I'm going to stop right here. What questions do you have about filler? Or do you have any?
Do we aspirate when we're doing the lips too?
Every single injection point, you always aspirate. It will take you longer to do someone's lips, but aspirate every single time. When you're watching TikToks and you're watching Instagram Reels, you will see people that do not aspirate. I have had to reverse several people's VOs where they were filming and they did not aspirate and caused a VO. Literally happened 3 days ago. Not our company, someone else. But to aspirate with every single injection point. It's just, it's like wearing a seatbelt. Any other questions?
I had a quick question about the training, if that's okay.
Yeah.
I think I was talking to another injector who's been with the company for a year now, and if I heard that we have to bring a model to the training. Is that true? Someone to inject? Okay.
Yes. Yes.
Just one is fine. Do we have
Just
to have
one.
cheeks in? Okay, perfect.
Yeah,
Thank
and
you.
they don't necessarily have to do cheeks and lips. It's really just so we can see you do filler one more time. The purpose of us making you treat the 8 is because we don't want you to learn, a brand new skill of neurotoxin and then also have to do someone's lips at the same time. You're already scared to do or nervous about doing someone's crow's feet. We don't want you to be nervous about doing someone's crow's feet and then also have to do somebody's lips. It's just a lot to take in. So it's our way of slowly kind of easing you into this aesthetic role. So get your 8 patients and then you can, you inject one more time filler in front of us and then you're free to order filler after that.
Perfect. Thanks.
Yep. Any other questions? Okay. Does anyone have any questions about general MFL operations? So anything that goes on within My Face Lady, stock transfers, payroll, telemedicine, any type of MFL operations. Do you have any questions about anything at all? Excellent. Okay. Moving on to AR questions. Does anyone have any specific AR questions that I can answer for you? Anything like traceability or notes or promotions, anything like that? Any AR questions? Great. If you are having difficulty with Evolus, I know sometimes Evolus acts a little wonky. They need to kind of get their stuff together. They keep having issues with AR, which is very annoying. Please just reach out to Brian and they can go in and put it in the patient's wallet virtually. Speaking of that, if you do accidentally not give someone a discount or a promotion, we are no longer going to be refunding that patient. We will simply put the overage into their virtual wallet so they can use it in the future. So please make sure that you choose, if there is a promotion going, that you choose it at checkout. We can no longer go back and credit, $10, $20 anymore. So what we'll do is we'll just simply go into the patient's virtual wallet and add the overage for later treatment. So please make sure that you know that going forward. Okay. All right. Now this week we are going to be doing some an Instagram or Facebook Live or Reel, and just kind of go on there and just again saying what you're doing. Talk about injecting. Talk about some of the things that you've done. You can talk about your launch party. It can be something funny. It can be something educational. It can just be you sitting in the car, looking all like happy, be like on my way to go see a patient today. Something super simple, but it needs to be a live or a reel. And then you're also going to be posting a before and after of a cheek filler patient. And I have that graphic for you. And then the education piece that you're going to be posting is going to be about how the face ages. Starting at 35 and kind of how those fat pads go away, that you stop producing collagen. So just an education post about how the face ages. This is something that you will recreate on your own. Continue following your social media network. Your social media following. Aesthetic_injector. She is very good, does a lot of education things. And then Injector Ken's also does a lot of education stuff before and after, just so you can get ideas of how to kind of boost up your own social media following and your own social media pages. All right, and that is it for this week. Does anyone have any questions for me?
I have a client that's she's flat out said she does not want a lip flip, that she just wants the smoker lines treated. So instead of injecting just the lip, would I just go a little bit above? I've had clients that I've already done lip flips on that have complained about the smoker's lines. And I just did a straight lip flip, but I did it with Dysport and it kind of cleared everything out anyways. But just wondering how I should handle that.
That's so a lip flip and smoker lines injections are the exact same. It is a marketing thing. That's it. You're treating the abicularis oris muscle. So it's the exact same thing. Old school, we used to call it smoker lines. And then the marketing world kind of got a hold of that and they were like, yeah, we're not calling that smoker lines anymore. We're going to call it a lip flip. So it's the exact same thing. It's the exact same injection points. The point of it is you are treating the abicularis oris muscle. So you can tell, okay, fine, I can do your smoker lines, but you inject it the exact same way. It's essentially a lip flip.
Perfect. Thank you.
Yeah. Any other questions? Perfect. All right. Well, I will see everyone next week for our very last call. Next week will be nice and short and sweet. We're just going to kind of do a quick recap and see if there's any questions. But I hope y'all have a great rest of your Sunday evening and see you next week. Bye, ladies.